From the last module, we talked about mental health promotion and prevention, and emphasis was placed on creating supportive environments, reducing stigma, and encouraging early intervention. Moving on in this module, we would look at mental health disorders in special populations like children, adolescents, older adults, and individuals with disabilities or chronic illnesses. This module explores the characteristics, challenges, and tailored approaches required for effective assessment and care within these groups. By the end of this module, you will be able to identify common mental health disorders in children, adolescents, older adults, and other special populations. Understand developmental and social factors affecting mental health in these groups. Recognize challenges in diagnosis and treatment unique to special populations. Apply appropriate strategies for assessment, intervention, and support. Appreciate the importance of family and community involvement in care. Mental health in children and adolescents. Mental health challenges often begin during childhood or adolescence. Some of the most commonly diagnosed disorders in this age group include attention deficit/hyperactivity disorder, ADHD, characterized by persistent inattention, hyperactivity, and impulsivity that interfere with daily functioning. Anxiety disorders. These may include generalized anxiety, separation anxiety, and social phobia, often presenting as excessive worry, fear, or avoidance behaviors. Depression. In children and teens, depression may manifest as persistent sadness, irritability, changes in sleep and appetite, and withdrawal from activities. Conduct disorders. These involve repetitive and persistent patterns of aggressive, antisocial, or rule-breaking behavior. Autism spectrum disorders, ASD, is a developmental condition marked by difficulties in communication, social interaction, and restricted or repetitive behaviors. Early recognition and diagnosis are key to managing these conditions effectively. Impact of developmental stages on symptom presentation. Children and adolescents experience rapid emotional, social, and cognitive changes which can influence how mental health symptoms appear. For example, young children may show mental distress through tantrums, clinginess, or regression in behaviors like toilet training. School-aged children might display difficulty concentrating, irritability, academic decline, or social withdrawal. Adolescents may experience mood swings, risk-taking behaviors, substance use, or changes in sleep and appetite. Understanding these developmental differences is essential for accurate diagnosis and appropriate intervention. Importance of school and family support. A strong support system is crucial for a child's mental health. Family support provides emotional security, early identification of concerns, and consistent care. Schools play a vital role in observing behavioral changes, offering counseling services, and fostering a safe environment for learning and growth. Collaboration between parents, teachers, and mental health professionals creates a holistic support network that can positively influence outcomes for affected children. Early intervention and behavioral therapies. Intervening early, especially during critical developmental windows, can significantly reduce the long-term impact of mental health disorders. Key approaches include behavioral therapies such as cognitive behavioral therapy, CBT, help children develop healthy coping skills and reshape negative thinking patterns. Parent training programs teach caregivers how to reinforce positive behaviors and manage challenging ones. School-based interventions provide support within the learning environment, helping children manage emotions and social interactions. Early intervention improves the likelihood of academic success, social development, and emotional stability as children grow into adulthood. Mental health in older adults. Older adults are at risk for several mental health conditions, including depression. Often underdiagnosed, it may present as fatigue, sleep issues, or withdrawal rather than sadness. Dementia includes Alzheimer's and related conditions marked by memory loss, confusion, and personality changes. Anxiety disorders may be linked to health fears, loss of independence, or bereavement. Late onset psychosis. Though less common, it can emerge in later life, often with paranoia or hallucinations. Key challenges. Mental health in older adults is often complicated by physical health conditions like chronic pain or heart disease, social isolation, especially after retirement, widowhood, or family separation, cognitive decline, which may mask or mimic psychiatric symptoms, geriatric assessment and tailored treatment. Comprehensive assessments consider physical, cognitive, and emotional factors. Treatment is often tailored, combining low-dose medications if needed, therapies suitable for older adults, supportive care to enhance daily functioning, role of caregivers and community services. Caregivers play a central role in monitoring well-being and ensuring treatment adherence. Community services like senior centers, home care support, and mental health outreach programs provide crucial social and emotional support to reduce isolation and improve quality of life. This focused approach ensures older adults receive compassionate and effective care that respects their unique needs. Mental health in individuals with disabilities. When we talk about mental health in individuals with disabilities, it's important to understand that this group often faces increased vulnerability to conditions like depression, anxiety, and trauma-related disorders. This can be due to a variety of factors, including social stigma, discrimination, or repeated experiences of exclusion. Now think about how hard it might be for someone with a physical, intellectual, or sensory disability to access mental health care. They often face significant barriers such as limited mobility, lack of accessible services, or even communication difficulties, especially for those with speech or cognitive challenges. Because of these unique needs, support systems must be specialized and adapted. That means providing appropriate accommodations, using clear communication methods, and ensuring that professionals are trained to work with people of all abilities. So we must be committed to inclusive care that respects the dignity and mental well-being of everyone, regardless of their abilities. Mental health in chronic illness populations. Let's explore how mental health is affected in people living with chronic physical illnesses. This is an important area because physical and mental health are deeply connected. Common co-occurring disorders. Many individuals with chronic illnesses like diabetes, cancer, and cardiovascular diseases often experience depression and anxiety alongside their physical condition. Why? Imagine being diagnosed with a lifelong illness. It can be overwhelming, stressful, and emotionally draining. That emotional burden can trigger or worsen mental health issues. For instance, someone with diabetes may feel anxious about managing their blood sugar or frustrated by lifestyle changes. Impact of chronic illness on mental health and vice versa. There's a two-way relationship here. Chronic illness can negatively impact a person's mental health, making them feel helpless, fatigued, or socially withdrawn. At the same time, poor mental health can worsen the physical condition. For example, someone with depression may struggle to stick to treatment plans or attend appointments, which could lead to complications in their illness. So, managing both together is crucial. Integrating mental health care into chronic disease management. Now, this is where healthcare needs to be smarter. Instead of treating physical illness separately from mental health, both should be addressed together. This is what we call integrated care. For example, patients could receive counseling alongside their medical treatment, or health providers could be trained to screen for depression during routine visits. This holistic approach improves both emotional well-being and physical outcomes. Understanding this connection helps us support people with chronic conditions more effectively, physically, emotionally, and socially. Cultural and socioeconomic considerations. When we talk about mental health, it's important to remember that it's not just a medical issue, it's also shaped by culture and socioeconomic status. These factors influence how people understand mental health and how they access care. Influence of cultural beliefs on mental health, perception, and help seeking. Different cultures have different beliefs about mental health. In some communities, mental illness might be seen as a spiritual issue or a personal weakness rather than a medical condition. This can affect whether people are willing to seek help or whether they even recognize that they're experiencing a mental health problem. It's important we show cultural sensitivity, respect diverse beliefs, and work to build trust when supporting individuals from different backgrounds. Addressing disparities in access and quality of care. Not everyone has the same access to mental health care. People from low-income backgrounds may struggle to afford treatment or may live in areas where services are limited. In some cases, even when care is available, it may not be culturally appropriate or high quality. That's why there's a growing need to bridge these gaps by improving access, offering community-based support, and training providers to offer inclusive, equitable care. So understanding cultural and socio-economic factors helps us deliver care that is not only effective, but also respectful and inclusive of everyone's lived experiences. In summary, This module underscores the need for specialized knowledge and approaches when working with diverse populations affected by mental health disorders. Understanding developmental, physical, social, and cultural factors enhances effective care and promotes better outcomes for these vulnerable groups.